Very, very expressive. And he's a wonderful golfer too. And so we've connected on so many on levels. I'm just so honored to have him as a friend and have him join us and share his expertise with us today. It's not too often as vocal teachers that we're put in front of a practitioner, a doctor, to learn about vocal anatomy and to see what happens when we go see an ENT. And to talk about that so we can then share that with our students and recommend that if they're having vocal trouble, then they should go see someone who is an expert in the field. Rather than a voice teacher who shows you a picture and says, here is the vocal tract. I feel like when David speaks to us today, it's coming from a very authentic, a very learned, and a very passionate and compassionate place. And so I'm very, very thankful. And I'm excited for Dr. Astrachan's talk with us this afternoon because I know that you all will glean a lot from what he has to say. So Dr. Astrachan, thank you for being here. And we can't wait to see what you have to say.
Matt, thank you very much. I don't know if I'll ever be able to live up to that wonderful introduction, but I really appreciate it. It's also a little difficult to follow the news of our president and vice president-elect, which I am so happy about. For those of you not on that political bent, I'm sorry. But for those of you who are, please do whatever you can to send whatever you can to Georgia so we can maybe help flip the Senate. Anyway, sorry about that. So I'm here to talk to you about the voice and my view of the voice, my 30-year plus practice, and the way I view the voice and people who come to see me with vocal problems. This talk is based on a talk that I've given to the opera students at Yale and opera students in opera singers in various locales. And I think it's applicable to anybody who uses their voice professionally or for fun. And I hope that you'll get a lot out of this talk. One thing I will tell you is that this is a topic, how to treat people, professional singers or vocalists, that is fairly new in medical literature. The first paper, the first article was not published until 1981, and the first textbook not until 1991. Most physicians, most practitioners have very limited knowledge of the voice and what goes into creating a good sound or what goes into singing. And voice professionals, being people who teach voice, people who work with singers, need to be familiar with how the voice works, how to hopefully fix it when it fails, and you need to be well informed that if there is a problem, you should seek someone who understands how the voice works, who takes care of singers, who gets it, because this is not something that all physicians, all practitioners know about. As an ENT, an otolaryngologist, we're trained to evaluate the upper airway. We can see the vocal cords, we can see the larynx with scopes or telescopes or mirrors. We are the physicians of the vocal tract. Now, that being said, when I trained in ENT, we had zero discussion about singers. We had zero discussion about the voice. We knew about the voice, and we would certainly take care of tumors or lesions, but what it was to be a singer and what it was to take care of singers and what goes into being a singer, we had nothing about. There is a bit more of that now in certain programs, certainly programs where there are, like in New York City or in Boston, but a lot of ENTs, I would say, don't really understand what singing is and taking care of singers. So it's a good idea if you're in a position where you want to talk to somebody or have a voice problem, that you seek out someone who has an extra interest in singing and in the voice, and if there's an ENT who's a singer. I started taking singing lessons when I was 37 years old, which seems like a long time ago. I'm now 62, and I became a much better physician for singers once I started to learn to sing. Much better. Now, singers are athletes. Professional singers are Olympic athletes, but your singers, your kids are athletes, and they require the same thing that any athletes require. They require training, practice, mechanics. It helps if they've got good genetics, and it helps if you approach them as athletes. That being said, I'm not going to talk about, at least from the medical perspective, the psychology of singers, but I will tell you, as in any athletic endeavor, confidence helps, focus helps, motivation helps, and it helps in the performance. So always remember, what it goes into being an athlete, having that confidence, and it helps if you're feeling good. It helps if you're healthy to have confidence and to be able to give your best performance. So what we talk about a lot when it comes to singing is we talk about the voice box. We talk about the larynx. Now, the larynx is a wonderful thing. I love the larynx. The larynx is a structure that first and foremost is a protective structure. The reason why we have a larynx is not to speak. The reason why we have a larynx is not to talk. The reason why we have a larynx is because we want food and liquid to go into our esophagus, into our food tube. We do not want food and liquid to go into our lungs. And so when the most primitive organisms came out of the primordial ooze and started breathing air, they needed some kind of a structure to prevent food and liquid from going into their lungs. And the larynx, which we see here, this is part of the larynx, the vocal folds. The vocal folds are first and foremost a barrier so that when you drink or when you eat, stuff does not go into your lungs. And so all of the muscles that move the vocal cords, except for one set, close the vocal cords. We have many muscles that close the vocal cords, and only one set of muscles open them. So when you swallow, the larynx is lifted up and forward, opening up the food tube in a very rapid reflex swallowing mechanism. And that swallowing mechanism is brainstem driven, and that swallowing mechanism we do hundreds and hundreds of times a day. And if it goes wrong, if there's a problem with the swallowing mechanism, people get very, very ill. So this is a photograph of a larynx. The epiglottis, which sits above the glottis. The glottis is a term for the vocal folds, the vocal cords. The epiglottis is above the glottis. The vocal folds open and close. Behind the vocal folds, in this area here, that's where the opening of the esophagus is. So the vocal folds open and close. The tongue would be up in this area. And this is what we look at when we, examine somebody's vocal cords. The term larynx, vocal cords, vocal folds, glottis are often used interchangeably. Now, when we talk about the glottis, and we talk about it, or the vocal cords, for the purposes of singing, what are we really talking about? We're talking about the glottis and these vocal cords coming together, air coming through them, and providing a sound. And that sound is a buzzing sound. That sound is a sound that then can be modulated. So when we look at the vocal cord anatomy, we have a very thin layer that's very pliable. We then have an underlying space or transition layer, and then we have muscle. Now this is a video stroboscopy. This is a picture of a test that we do, or examination that we do with the scope, and we use a stroboscope. So there's a flashing light, and that allows the vocal cords for us to see them slow down as they move. And what I want you to notice on this is the wave motion of the cords.
Now I want you to give me a he, he. Hold it as long as you can.
That little white stuff there is moving.
Take a breath.
Okay.
Now go. Ooh, ooh.
See how the cords come together, and then there's a point that
Okay.
they're closed completely.
He,
The cords
good. One more time. He,
down into the trachea.
good. Stop recording.
And that gives us a wonderful way to assess the vocal cords when there's subtle problems with the voice. Now, given the fact that the larynx's primary purpose is to prevent food and liquid from getting into the lungs, it's got muscles that attach to it. And these muscles that attach to the larynx, these swallowing muscles, are designed to pull it up, pull it forward, depress it, move it. And these swallowing muscles, which are great for swallowing, are not good for singing. You don't want to get your swallowing muscles involved, squeezing or pulling or tightening. And so when you have a singer, you want to make sure that they maintain a relatively constant position so that the muscles that have to do with swallowing aren't getting involved. And if the muscles do get involved, that can lead to tension in the voice box. So we talk about the supraglottic vocal tract, the vocal tract above the glottis. Now, I think of the body when it comes to singing in three different parts. The first part is the vocal cords, and the importance of the vocal cords vibrating and making a sound. To power that sound, you need air. Air has to go through the vocal cords in a nice way to create that sound. And so you need air, you need power, you need fuel. I often compare to patients, I talk about the voice box as a car engine, an 8-cylinder car engine, and you want to give it 8 cylinders worth of gasoline. If you only give it 3 or 4 cylinders worth of gasoline, your engine's not going to work as well. Now, above the vocal cords, you have the vocal tract, and it's the vocal tract, the larynx above the cords, the tongue, the lips, the palate, the pharynx, everything. All of that is what gives a singer their sound. And minor changes in the vocal tract can cause significant changes in the voice. So this is a little quick video of how I see or how I feel about the voice. and it's very interesting. It takes a buzzer. This thing right here is a buzzer. It just creates a buzzing sound. This weird looking thing is a vocal tract from a person who was singing in an MRI machine. They watch them as they sing and make a sound, and then they constructed this vocal tract out of polyethylene and plastic. And so this shows how just a buzzing sound and a vocal tract creates a sound. And there's 3 different parts, 2 male and 1 female. Just a different exactly like the person who they modeled. So a little freaky.
Hey, Dave, just so you know,
Yes.
when the video is playing, we're having a hard time hearing you talk
Okay.
over the video.
Okay. So the the so what I was saying was that you can take the person whose vocal tract they designed, and people can listen to that sound and they know exactly who that person is. So what makes a singer sound the way that they sound is their vocal tract, and how that vocal tract is then used. So when we talk about the voice and when problems can occur, they can occur in those 3 areas. The area of power, the airflow going up and through the cords, they can occur at the cords level, or they can occur in the vocal tract itself. And so when I think of singers, I'm looking at those 3 different areas and trying to figure out when problems arise, where they could be from. So the tracheobronchial tree, the lungs, the thorax, that's the fuel pump. That supplies the air that passes between the vocal cords. That provides the power. And to be a great singer, you have to be a great breather. And great singers are great breathers. They use more proportion of air in their lungs than normal people. Now, the abdomen, the support of the singing voice, generates the force, and abdominal muscles have to work together to maintain an efficient, constant source of power, getting the air through the cords. So you can imagine if somebody's had abdominal problems or abdominal complaints, or someone's got issues with chest issues, or have had a cough, or aren't breathing as well as they once they normally do, it's going to affect the voice. Now, the musculoskeletal system is involved as well. How you hold your neck, how you hold your jaw, how you stand, how your neck and back are positioned. And one thing that I see very, very common, especially in singers who aren't quite as well trained, is a lot of tension. Tension in the jaw, tension in the facial muscles. And the jaw joint is right in this area. It's involved in all actions of the jaw. And I will tell you, earache, headache, migraine, tinnitus, ringing in the ears, dizziness, all can occur from problems with the jaw. I am a big anti-chewing gum guy. I think chewing gum is terrible, and if you've got kids that are crunching on chewing gum, you might want to tell them to cut it out, because there's only so many chews that everyone's jaw has, and you don't want them overworking their jaw muscles. So when somebody has a voice problem or a vocal problem, again, I try to figure out, is it, where is the problem coming from? What's the issue? What is the problem? Hoarseness, fatigue, volume issue. For professional singers, it's as their livelihood. Do they have to perform? Do they have big auditions coming up? Vocal training is a big issue, and I certainly heard the last speaker speaking about the importance of having good training and good education about the voice. And I cannot tell you the number of patients who I see who say to me, when I ask them, when was your last voice lesson, they'll say, I've never had a voice lesson. And I'll say, well, the best athletes in the world have coaches. So maybe having somebody take a look at you or listen to you and work with you on your technique might be something very, very helpful. Allergies, cold symptoms, again, these are things that can affect the vocal tract, breathing, affecting the power and the vibration of the cords, neck pain, issues of hoarseness, bad breath, phlegm, hearing loss. If you're not hearing well, you don't get good feedback of how you sound, stress, tension. Hopefully everybody's stress and tension's a little bit less thanks to the good news we just heard. Problems gaining or losing weight, hormone problems, smoking, certain foods can affect the voice, medications, and if people have had any kind of surgical procedure where they required a breathing tube down their windpipe, very important to know about. Now, the most common thing that you'll see, especially in with kids, is colds and upper respiratory tract infections. In the olden days, before COVID, we used to think that a cold was a cold. Now, if somebody calls me and tells me that they've got congestion, a head, fever, stuffy nose, I'm sending them for a test. Sometimes having a cold is not so bad. You can still sing as long as you resist the urge to clear your throat and you're paying attention to your sound, because you're not going to sound the same. If you have a cold, your vocal cords get a little bit more swollen. They don't vibrate the way that they normally vibrate. And so you've got to be aware of not changing your technique to try to match what you think you should sound like. So if a patient comes to me, I examine their ears, their mouth, their nose, their throat, and very important, the ability to look at their larynx. Numb up the nose, decongest the nose, and then look with a fiber optic scope. Now, this is an examination of a very, very prominent singer with phenomenal technique, but he happened to have some issues with his voice and just wasn't feeling great. Came to see me with an upper respiratory tract infection, and this is the exam. Oh, I'm going to go back to that. Sorry. Here, we're going to try that.
And on the right is the septum, which is a wall of bone and cartilage. And yours deviates a little bit to the side. You can see that deviation there. So
this right here, I'm sorry, we're in the nose. This right here is the opening of the eustachian tube. If we were able to just go right up in there, we'd be in the ear. So you can see how the nose and the ear connect with each other. Right here is the palate, and you'll see that moving in a second.
Back on this side. Breathe through your nose. So that's your palate going down. This is where the adenoids once lived. Let's take a look on the other side. And here you see your septum again.
So this is called a turbinate. Turbinates make mucus. This is called the middle turbinate. Over here was the inferior turbinate, and you can see some delicious mucus here, which was consistent with his upper respiratory infection.
Deviating a fair amount of mucus there by that thing's called a turbinate. So that would indicate consistent with being sick. Let's go here now to the back of your throat. Now just breathe through your nose. Breathe through your nose. Lift up your chin. Good. And
so we're looking at the epiglottis here. The vocal the arytenoid cartilages, which move the vocal cords, are here, and right back here you can't see the space, but that's where the opening of the food tube is, the opening of the esophagus. But the only way for food and liquid to get there is this whole structure here has to move up and forward.
there's your larynx, and just say he. Take a breath. Good. And take a breath. And give me a little throat clear. And
If that voice sounds familiar to you, there's a reason for that. Anyway, you can see the mucus here, the mucus on the cords, but this is not terrible.
Good. Take a breath. All right. There we go. Okay, good. Stop recording.
So that wasn't bad. If that particular singer sounded familiar, it's because he's very amazing and famous, right? Right, Matt?
Absolutely. I was so sick, Doc. And I was feeling better in like 3 days.
But he could sing with that, even with that. I mean, he could still sing. He's not going to be happy with his voice, but there's nothing about that was dangerous. Now, vocal nodules, these are the types of things that we would see in like cheerleaders who really abuse their voices. The voice and the vocal cords have maximum impact in the front third of the vocal cords. And so this is where typically you'll see calluses or nodules. And these people have a very rough voice. And this is an example of, this is just one picture that's taken from a stroboscopy. And you can see, remember in the first strobe, I showed you how the cords came together very nicely. And here you can see a space here and a space there. And I'll show you another strobe in just a bit that shows that. Now, more common are these sort of subtle little soft nodules or polyps. And sometimes these will go away on their own. If not, a microsurgery can be curative. This is a granuloma, which is a a structure that can occur when the cords have been damaged for some reason, and then they try to repair themselves. And usually they're secondary to reflux with stomach juice that comes up into the throat. This is a scope from someone who has a very significant problem with something called muscle spasm dysphonia, where the muscles that support the larynx, we talked about those muscles that lift the larynx and bring it forward, when those muscles get so tight and squeeze so hard that the patient can't talk.
Go here. Okay, stop for a second. Now go like this. Go from your belly. Go. No, from the belly. Okay. Try going. Give me a cough. Good. Okay. Now cough, and can you clear your throat? Can you stop recording?
So she could cough and she could get her vocal cords to come together nicely, but she had so much tension and so much spasm that she couldn't make a normal sound. And this is a pretty serious problem. Sometimes, believe it or not, it actually gets better when the patients are put on anti-anxiety medications and they sort of calm things down. Sometimes it responds to speech therapy, and sometimes they need Botox injections. So this is a stroboscopy of someone who's got a pretty normal looking voice box, but their voice just is not where they think it should be.
And just go he. Give me a he. Okay.
And you see there's a contact area right here. Air is escaping here and air is escaping here. And so this is a very subtle finding where she has two small little cysts in her cords.
Breath. And he. Okay. Stop recording.
She didn't sound that bad. Her speaking voice seemed normal, and even her singing voice seemed pretty normal, but she's an opera singer who just felt that she could not do what she normally needed to do. And I ultimately referred her to a specialist in New York City who all he does is professional voice. That's his whole practice is professional voice. There are certain physicians in the world who all they do is take care of voice problems like this. And we all know about Adele, we all know about other singers, we all know about Julie Andrews and the problems that she had. So when it comes to surgery on people with professional voices, you've got to go to somebody who that's all they do. We sometimes will see cysts, which are often following trauma. One thing that I'm be very careful about is if somebody comes in after really screaming or really yelling, they can cause bleeding into a vocal cord, and vocal cord hemorrhages are really bad because they can lead to permanent scarring of the cord. I'm not a big fan of singers using anti-inflammatories unless they absolutely need them. And if you are using an anti-inflammatory, you really want to stay away from anything that requires a lot of screaming or yelling. Laryngitis just means inflammation of the voice box or inflammation of the larynx. Typically it's from a cold or an upper respiratory tract infection. Voice rest usually is all that's needed. In general, if you don't have an allergy, don't use an antihistamine because antihistamines can be drying. Hydration, hydration, hydration. Steam can be really helpful. And then in some cases where people really have to perform, last resort, I'll on occasion put people on oral steroids. Sinus infections, again, when you're talking about problems that are of the vocal tract, if you can't breathe well through your nose, if you're congested, if you're stuffy, if you've got mucus, you can't create the sounds that you want to create in your head voice. You've got to look to what could be going on. And very often, following an upper respiratory tract infection, people will develop nasal obstruction, congestion, discolored mucus, altered senses of smell and taste. And that's often where I'll see them, and if needed, antibiotics or irrigations, something to help with that. Now, reflux, you've got to be aware of the idea of laryngopharyngeal reflux. It is very common to have stomach juice coming up and not be aware of it, and we call that atypical reflux. Stomach contents can come up into the throat. It's not just a problem with acid, it can be acid-activated enzymes. Most people who come to see me that complain of postnasal drip, phlegm, mucus, throat clearing, it's not the nose. I would say 70–80% of patients with chronic throat clearing and chronic mucus production, it's reflux. Even if they don't have heartburn, even if they don't have any sensation of stomach juice coming up. I cannot tell you the number of people I have cured of postnasal drip, putting them on antacids and telling them to stop drinking so much coffee and stop drinking so much tea or iced tea, and God forbid, never drink Crystal Light. There are so many things that are out there that are directly irritating and cause inflammation to the voice box. You want to avoid all of those. Medication can help, but the key to improving reflux is diet and lifestyle modification. Not eating or drinking for 3 hours before laying down, not eating or drinking before activities that increase intra-abdominal pressure. You know, I have so many patients that like to exercise, they like to do abs. You don't want to eat or drink before getting on the floor and doing abdominals. And then there's certain foods and liquids that can affect both the lower and upper esophageal sphincters, which are muscles that encircle the top of the food tube and the bottom of the food tube to prevent stuff from coming up. Alcohol, spicy foods, chocolate, garlic, all of those can affect reflux and cause problems. If you do have reflux or you know someone who does, this is a great book called Dropping Acid. It's a cookbook and a cure. Jamie Kaufman is an ENT doctor who specializes in the voice, and she partnered with another doctor and a chef to come up with a very good diet plan for reflux. Allergy certainly can affect the upper the upper vocal tract and can affect the lungs and breathing. Rhinitis, asthma, cough, and antihistamines, if you have an allergy, can be very helpful. Steroid nasal sprays, inhalers, all of those can be very, very helpful. Now, when to suggest a referral to a physician voice specialist, okay? If someone's singing and they're having pain or they're having discomfort, that's a good reason for a referral. If their voice has changed for more than 10 days, despite vocal rest, hydrating, you know, staying away from bad foods, that's a reason. A vocal change following an illness, you know, breathiness, raspiness, or fatigue, that's a reason. Now, if somebody's got, if one of your singers just has a cold, or you know has congestion or has viral illness, then the regular practitioner can see them and deal with that, or if they're having some ear pain or ear congestion, that's certainly something that a regular practitioner can handle. It's really the when you're concerned about the larynx, you're concerned about the vocal cords, because we can see it. We can look and we can see what's happening with them at that particular time. So that's just a short blurb about when to refer. Now, these are two helpful products. The first product that I love is called Ponaris Nasal Emollient, and it's got a picture of an astronaut on it, and that's because every manned space flight that NASA has sent since Gemini, all of the astronauts complained about their noses being congested and stuffy, crusty, and so Ponaris was designed for them, and it's a combination of natural plant products, eucalyptus, different cactus oils, and iodine. And Ponaris actually, because of its iodine, has, well, there hasn't been a study about it, but there have been studies talking about the benefits of iodine in people's noses in dealing with or preventing COVID. COVID is killed and inactivated by iodine, so Ponaris is super nice for that. And then there's something called a NeilMed Sinus Rinse, which is a nasal rinse that people can do half a bottle each nostril twice a day if your nose is congested and you want to just help keep it clean. Now,
Hey, Doc. Excuse me, Doc.
Yeah.
Can you talk about, is that basically a neti pot?
Well, it's similar to a neti pot in terms of just putting saline in the nose, salt water in the nose, but you actually squeeze it so there's more force going through to help it to do a better job in cleaning.
And you would also recommend steaming,
Steam,
personal steamers, those things are helpful as well?
Yeah, steam is great. Hydration, steam, all very helpful things for your airway in general, for your nose in general. Now, the last slide that I have is sort of interesting. At the beginning of the talk, I showed you the eustachian tube opening and how the nose is connected to the ear. This is a patient who came to see me with several weeks of hearing loss, and this was following a flight. They had flown and had a cold, and they'd had tried a lot of different things, medications, but it didn't work. So what I had the patient do, which is very, very helpful and a very useful procedure, is I had them hold their nose and blow into their closed nose. That's called a Valsalva's maneuver. You hold your nose, you take a breath, and you push. And I wanted to show you what that looks like. This is the eardrum. This is the hammer, the also known as the malleus. The incus would be up here, and here we go.
And hold your nose, take a big breath, and push into your nose. Push. Push. Good. Good. Stop. Did you see those bubbles form?
I did.
Stop recording.
And that is my my talk. Have you been opening it up to questions, Matt?
No, we're just talking about, in the chat, we're talking about personal steamers right now. And just kind of singing your praises and saying that I send all of my students to you when they have problems. Because I know, in the throes of, gosh, tech week of a show, or we've got a concert or a competition coming up and a singer is going through some vocal trouble, I know that rather than vocal rest, sending them to you will yield faster results. And also, besides that, they'll learn something about their instrument that they wouldn't have known in simple vocal rest. I know just our interactions really have illustrated and made clear all of the things that I learned about in college in terms of the anatomy of the voice. But when I'm with you and talking about it, it is kind of in technicolor, really, and it's kind of fun to watch as the scope travels through my vocal tract up on the screen and having you narrate. Uh, it's pretty amazing. And I'm very thankful that, gosh, you're here in Hamden, and you also have a practice in Madison, right? Is that the same practice though, right?
Yeah. So Madison, also Madison and Milford.
Cool. Doc, can you speak a bit about the impact of the voice of singing through masks?
Singing through masks. So the voice is going to sound different through a mask. You're going to hear, if you're the singer, you're going to hear it different in your head. And the important thing is to not try to change the sound that's coming out of your mask to fit something that you think should be in your ear or is in your head, because you don't want to introduce subtle changes in the swallowing muscles to try to change the sound. So I think it's important. I haven't myself had this problem because if I'm doing a lesson, I've actually been doing it through Zoom, so I haven't been singing through a mask. But I think it would be important for the if we're talking about kids that they sing something without the mask at home perhaps, and then put the mask on and just sort of listen to the change and accept the fact that that's what it should sound like.
May I ask a question?
Sure.
Please.
I guess following on that, other than, so I've been noticing that in my first days of teaching with a mask on, my voice was getting so tired. And as someone who went through some vocal issues about 12 years ago, I'm hypersensitive. So I've started wearing my Britney Spears microphone again. Every day every moment I teach with my mask on. But I guess other than what you've already recommended, do you have recommendations for us? Because I know a lot of my friends are saying my voice is exhausted at the end of the day. What can I do? And I just think we all need to be really aware of that right now. And I'm going to predict, I feel like you're going to probably start seeing people with more vocal issues who are overusing their voice in this time. But do you have any other recommendations for us?
Well, it's a really good point, because since a lot of my practice involves hearing loss and people who've had a lot of birthdays, I'm doing a lot of work with people that just don't hear well. So I have to always be conscious of supporting my speaking voice as much as possible and really projecting as much as I can to be heard, because the mask not only decreases my sound, but it also, so many people that I'm in contact with don't even know how much they lip read. And so without their ability to lip read, they're having even more difficulty communicating with people through the mask. But yeah, if you're talking a lot, you need to be aware of it. If you start to feel something in your neck or start to feel something, tension, stop talking. Take some breaths, recenter, and then just go on. I mean, it's really important to not add to the tension in your neck as you're going on.
Cool. Doc, I have a question. Should trans singers on hormones be checking in with ENTs or voice specialists?
So it's really important so what happens is that if you're used to having your vocal cords vibrating at a certain frequency, and that frequency is now changing because of hormone changes, you need to make sure that your technique is good. So I would go first with the voice teacher, the vocal teacher, to make sure that the technique is good. But if they're still having problems with that, then probably having their larynx examined fiber optically is important to make sure that they're not developing nodules or developing other problems. But yeah, if you're used to vibrating your cords at a certain frequency, and then that frequency is changing, again, you're hearing it differently, and you're going to try to do things that are different. That needs to be that needs to be taken into account.
Yeah, Doc, and I would just follow up that I would see you whenever I could, to be honest. Again, just to check in, because we all use our voice all the time. And it's important to just, I feel like just like we do a yearly physical, that we have a check-in with a specialist that deals with what we do.
Matt, you know, I'm always happy to see you. Any other questions?
Oh, sorry. Following up on the hormone question, I just know sometimes people taking testosterone run into issues with vocal fold size in an unchanging larynx. Have you had experience with this?
Vocal fold size in an unchanging larynx. Well, I guess you're you know, again, if the cords are thickening, or the cords are changing their it would be in that transition area of the vocal cord. There could be more more water or more muscle, perhaps. Again, it just has to do with changing of the vibration. It's just changing the vibration.
Cool. Well, Doc, thank you for your time and your expertise. I know that learning about this with a specialist is especially educational for all of us. The visuals that you provided were really illuminating, no pun intended, as we look at things that we don't often look at. Oh yeah, everyone should turn on your cameras because it's time to go and say goodbye. But Dave, yeah, we're super appreciative, and we're looking forward to having your stuff on our website so people can check in and check in with you if necessary. Again, I would encourage all of you to make an appointment and check in. I mean, really, it's amazing, and an important element of understanding in what we do, so that we can then communicate that with our students and parents who need to hear it.
So I will say one last thing. I mean, if there is a case where there's a vocal problem, or there's a pressing engagement, or something needs to get done, and you call somebody like me, and who's a voice specialist, and you're told, well, we can see you in 3 weeks. Say that, well, we heard Dr. Astrachan give a talk, and we understand it needs to be dealt with now. Can you just check with him, or if there's another doctor, about when we should be seen, or can we leave a message? That way you'll bypass the wall that is supposed to protect me against losing my mind from working too hard. So I'm always able to add people on. I have that wonderful ability in my office. So if you're told that'll be 3 or 4 weeks, say, well, we understand from Dr. Astrachan that we may need to be seen sooner, and don't take no for an answer. Okay, just say, well, leave a message, please. We called, check with him, thank you, because my staff knows that I do that.
Yeah, seriously, like Doc will see me the same day, and he's like, "Can you make it in an hour?" I'm like, "Yep, I'm there."
Well, I just look at my schedule and I figure out how long it takes me to eat a sandwich, and I just decrease that.
So helpful. So,
Thanks.
Doc, thank you very much.
My
Guys,
pleasure.
it's so great to see you all and to spend a Saturday morning with you. What a joyous Saturday morning it is for so many reasons. So, guys, be well and enjoy this beautiful weather. And we will see you in December for some fun holiday spirit.